Welcome to Insights on Innovation for Self-Insured Employers. My name is Steven Collens. I'm the CEO of MATTER. Today, we have the second program in a series that we've developed together with one of our partners, Livongo, which late last year merged with Teladoc. We held the first event in November, and if you missed it, you can watch the replay on our site at matter.health/live. The series, Insights on Innovation for Self-Insured Employers, is focused on the role of employers as healthcare companies. In the US, half the population receives health insurance through their employers, and roughly 3/4 of those receive coverage under a self-insured employer plan, which means those companies are bearing much of the risk associated with the health of their employees and their families. So whether they like it or not, US employers are healthcare companies. Employers have, for a long time, purchased health and wellness solutions for their employees, but with many of these solutions, the ROI was, at best, hard to quantify. In recent years, new classes of digital health solutions have proliferated, and there are new kinds of solutions that promise a greater and more tangible ROI for employers and employees, both in terms of health outcomes and financial results. Today, we want to dig into how employers are making decisions about which solutions to acquire for their employee populations, how they're measuring the outcomes delivered by the solutions they decide to implement, what works, what doesn't, what's the definition of a positive ROI for these kinds of solutions, and how are they measuring it? We have two leaders in this field with us today to have this conversation. First, we have Courtney Stubblefield, who serves as the solutions function leader for Willis Towers Watson's health and benefit business. She's worked in this arena for more than 20 years, advising employers on their health and wellness plan offerings. She began her career as an actuary. I'm going to try not to be intimidated by that. And she is in many ways uniquely positioned to help us understand how companies measure and evaluate health and wellness solutions. Our second guest is Glen Tullman, who is a prolific entrepreneur and investor. He is a rare entrepreneur who's achieved success across many businesses in different industries, most recently with Livongo. He founded the company, served as its CEO, and then executive chairman before its combination with Teladoc late last year. Glen is also the co-founder and managing partner of Seven Wire Ventures, a healthcare-focused investment firm, and more important than either of those things, he serves on the board of directors of MATTER. I'll be guiding the conversation today. If you have questions you'd like to ask any of the panelists, please use the chat function, and I will incorporate them as best as I can throughout the conversation. And one final note before we get started, for those of you who signed up for the post-event networking, you'll receive an email from Kay Nietzkaj in a few minutes that will include a separate link to click on at the conclusion of the main program. So with that, let's jump into the conversation. And Courtney, I will start with you. You have a perspective as an advisor to many companies. So start with what are employers looking for when they're evaluating health and wellness solutions for their employees and their families and their retirees?
Yeah, no, great question. And there's a lot of things that employers are looking for. I think, you know, with the innovation that has come out over the last many years, right, with technology and products, I think employers are looking for both impact and value in the terms of economic value, savings, better quality, better health outcomes, but they're also very importantly looking for ways to improve and enable their employees. So that employee experience and, you know, letting people meet their needs better and personalize care in new ways using those new technologies and products is a critical part of the equation. So it's really a myriad of things. I think also very importantly in all of that, and there's tons to unpack under each of those, is how will a solution fit into their environment? So most employers, right, have well-defined strategies. I mean, from the top around their employee value proposition down to their healthcare strategy. So anything that they add in, they want to add value, not confuse employees, and not befuddle the ecosystem, basically. So all of that comes into play. So in a nutshell, those are kind of, I think, the full range of things that employers are looking to get.
And how, just sort of generally within that constellation of things, how would you characterize the weight that you're seeing employers put on financial ROI versus kind of measurable health outcomes versus maybe some of the kind of, I don't want to call it fuzzier, but other ways of characterizing the benefits that solutions impart to their employees and their families?
Yeah, I mean, I would say that the weight is shifting toward wanting to see economic value and positive ROI. I feel like there has, and employers see that there's been a period of time where I think adoption grew, right? Maybe over the last 5+ years. And there was a willingness to, add more into their strategy and their ecosystem to see what would meet needs better. So I think we've reached the period of time, and then where they want to see the results, and it's time to kind of bring that home and be able to show impact. I think so. I think more than half the equation now is tied to economic impact and improved health outcomes. But that other piece is still there. So that's where we're focused on, is a lot of ways we can help employers assess effectiveness using data, and building ways to do that in a more common structure. So it's, so by category or by solution domain, we can be able to talk about the effectiveness, the comparative effectiveness across solutions, and what that meant for the employer. So I think it's been an evolution.
So I want to come back to some of those specific, specifically how you measure these things and how you're helping companies do that. But Glen, you launched Livongo in 2014. Last 6 years have been pretty significant in terms of the proliferation of digital health solutions and a lot of kind of what's happened in the ecosystem. How does the way that Courtney characterized the shift in how employers are looking at solutions and looking at technologies, does that jibe with what you've been seeing through the course of this business and the others that you've been involved with?
Yeah, well, first of all, Steven, it's always great to be with you, and it's great. Thank you for doing what you're doing at MATTER, which is pushing innovation and connecting our large self-insured employers and many payers and the like with innovation. I think that's been really critical. So thanks for doing that, and thanks to everybody for joining. I agree 100% with what Courtney said, and I want to add one or two things. I think that with coronavirus, what's happened, there have been kind of two big pushes. One is employers, large self-insured employers in particular, and everyone, I hope, has realized how critical it is to keep people healthy. And, we are all one community. We may be divided in politics and lots of other places, but we're all one community in health. So I think everyone has understood essential workers, a new term we all learned. It doesn't matter. You have a warehouse worker, you have to keep her or him healthy. And so people understand that. But the second piece Courtney talked about is also really important, and that is we're going to have an economic challenge going forward. And employers are going to look very carefully at expenses. And most employers will tell you their largest uncontrollable expense is healthcare, which is kind of fascinating. So what would I add to what Courtney said? I would add one thing that I believe employers are really looking for, and that's alignment. So how does that come out? Well, they want to see whether it's a payer, a PBM, a health system, they want to see that there's alignment. And part of our challenge today, that our system is set up that when payers, PBMs, and health systems make more money, employers pay more money. And so there's a lack of alignment there. And I think that's something we're going to see a lot more shared savings. We're going to see that not just from the three groups I mentioned, but also from the vendor community. And they're going to come to people and say, if it's so good, why don't you go at risk? And I think we're going to see a big shift to value. You know, I would, if I had to summarize it in 3 words, I'd say less innovation and more results. I guess that's 4 words, but they've seen, we have hundreds of solutions now. And the goal is, how do we make that an easier experience for the member, for the employee, make it easier to stay healthy, number 1. And number 2, how do we make it easier to do business for the employer? You know, and part of Livongo's success was we started making it easier and better for members. And we also had real measurable benefits for employers. And the extension, the merger with Teladoc, was all about how do you now broaden that to focus on the whole person and give someone one place to go where they can get virtual care. And I think that's the new big term. If there was one new big term for this year, it's virtual care. There's a lot of definitions for it, but that's the new term.
So Glenn, I, from a Matter point of view, I'm a little bit allergic to something that says less innovation is going to be good. But so maybe let me poke on that a little bit. And I think what you're talking about is different kinds of innovation, and innovation in shared savings, in risk sharing, in
that's
pricing,
true. I mean,
and kind of.
You know me well enough. That was a little bit of to get you going. That was, you know, I'm all about innovation. I think, however, that if you did talk to a lot of our self-insured employers, and what they'll say is, I've got, you know, 10 different companies in every area coming at me. How do we organize that? How do I, if I'm a member, if I have multiple chronic conditions, the world has become more complex, more confusing, and more costly than ever before. I have 4 coaches, 3 apps, 2 different, you know, and it's kind of like, oh my gosh. So that's, again, this idea of help me organize it, both for the individual, and that's an innovation in itself. Can we get someone to put this together and create a new, more holistic kind of experience? And I think, again, that's what's coming. That's what's going to be new.
Courtney, talk a little bit about that process. So, you know, as you're helping companies look for and evaluate solutions, what are the different things that you're hearing from your clients that they're most interested in assessing? You know, you mentioned earlier the different measurable, quantifiable you know, things to look at. You also measured kind of how does it fit into their ecosystem, which I think touches a bit on what Glenn was just commenting on. You know, what does that process look like?
Yeah, I can definitely talk about kind of the process we go through. I think the point, just to hit one thing on the point that was just made though, about, I think it's about change management at some level when we start to get into the value-based care space. And so there is no doubt we have been spending years trying to identify the right ways to change how healthcare is paid for, right? And you know, there has been very slow progress. Employers have borne the brunt of being the commercial payers that pay the most. And, you know, but the solutions that have emerged initially require a lot of change. So we need to continue to think about the element of change management in the equation, because if I tell employees all of a sudden, you have a much more narrow network than you've ever had, you can only go to these providers. But we've vetted them for quality, and they're using bundled payment arrangements. It's not a fee-for-service, volume-driven approach. There's all these there's a real decision-making process that employers have to go through, right? And they have to continue to understand and care deeply about their level of competitiveness with peers and industry and that sort of thing. So I think we have a whole layer of solutions that have operated maybe above that. And now we're seeing this movement toward trying to integrate those solutions more deeply into the health plan. And when you get into the health plan, right, typically often provided by a large major carrier, how do we steer and navigate people through that? And are there solutions that can help do that? And there are. There is a whole suite of emerging solutions that provide treatment decision support, that provide center of excellence with incredible services wrapped around them. Very attractive, very appealing. Word of mouth helps spread that kind of experience. So it is exciting to see, I think, the evolution from just the point solution to something that really can transform how an individual first is intercepted and then ideally reaches into that solution for their needs, for their wants, and then uses that to propel them as needed through the healthcare system in a more effective way. So that's the inspirational, I think, transformational kind of change that we can see. So back to how do employers evaluate, right? And how do we start this process? I think, you know, there's a lot of data that goes into that front end analysis. We start always, and I'm going to speak a lot from the point of view of a consultant working with employers. We start from looking at the employer's strategy. What are their goals and what do they need to accomplish? That's exciting and fun because every employer is different. It's also challenging because every employer is unique and different. But we do have some commonality of things we've talked about, right? Looking for economic value, looking for ways to not just save money, but also improve health. I think, frankly, through the pandemic, there's also an intent in a lot of employer strategies to just try to improve life. I think it's broader than even just, you know, we can say health and well-being, but how do we make people's lives better, even with more low acuity solutions that, like a caregiving solution, which has been in great need this year. But we start with the strategy, and then we look at, you know, what is the set of solution or the solution domains where there might be gaps. Where might there be gaps today based on kind of comparing their strategy and their plans with data that tells us what their top conditions are? Where are they spending money? What are they spending money on? What geographies are driving the most cost? What are the demographics of the population? What's the turnover of the population? What are the preferences? We do something called a total reward optimization analysis, so we can understand what people really want and need. Increasingly now, we're trying to talk about, you know, health equity issues in a population, and they're very substantial. You know, and that could be by location, often is, and that could break down by business group in different ways. So there's just a real, you know, many layers of getting the data and understanding what's driving cost and what the needs are. From there, you know, we move into oftentimes what are potential solutions. So it's real important. We have a lot of people that spend time assessing the marketplace, looking at, you know, innovators, looking at solutions that have come to bear, and, you know, moving into an evaluation selection process for that employer. And, you know, again, I'll come back to it again. A key part of that is how would this potential solution fit into the current model? Does it displace an existing process? That oftentimes is the case. There's something better out there than what we're doing today. Or is it complementary? So there's a lot of, you know, design thinking that goes into looking at what needs to come into play and how we evaluate it. And then, you know, implementation, communication planning, targeted outreach. I mean, there's a whole suite of things we do, you know, through that process to then best align the employer with this right solution. And then we get into the, you know, kind of ongoing performance, you know, measurement, monitoring, and that sort of thing. So, yeah, a lot there.
And there is a lot there. And what is, just to clarify for people, the role of the employer versus the role of the provider and the role of in particular, the insurance company? As you're advising employers in particular, what's the interplay there, and to what extent have employers started to make more or not decisions about health solutions in the past several years?
Yeah, I mean, I think when things are done the right way, there's careful coordination with the underlying health plan, health carrier, in terms of integration. So in a situation where an employer is evaluating adding, let's say, a digital health solution on a direct basis, there would be very good upfront preliminary conversations with maybe not just the carrier, maybe there's a navigation solution that's also in play to talk about how this would fit in. So that really comes into the design and integration planning. I think, sometimes these, solutions are accessed directly through the health plan, the carrier, or the PBM, or maybe it's the Ben admin solution. And so, it kind of depends on the channel through which those are kind of being tapped into. But, our job, as I work at WTW, and we have teams of consultants all over the country working with our clients. We see ourselves, we're the voice of objectivity, and we're coming in, without conflicts, really to try to advise the client absolutely the best way to add value for them. So that's always our frame, but we do definitely bring in all the major stakeholders. That's a huge part of the process. You mentioned providers directly and employers. Interestingly, this is a trend. More employers are working directly with providers, with health systems. There are solutions emerging in this space to just make it more fun and complex. Working directly with a health system in a local market, whether that be a comprehensive health plan option that the health system's developed, or whether that be for a particular service line, or a center of excellence for a particular type of condition. Virtual care solutions have emerged in some markets directly with health systems. So it takes the right kind of employer to want to embark on that, because it's a complex engagement. But I'm sure many in the audience have seen the stories. Boeing has done this very effectively, General Motors, and they've talked about those stories. Walmart, of course, with their directly contracted Center of Excellence program across the country. So yeah, we're kind of talking across the continuum, but lots of ways those stakeholders engage.
Let's
Steven,
dig in.
I just one
ahead.
comment I want to make. The way you framed the question I thought was interesting, because you listed 3 parties driving change. And I think the 4th party that's actually going to drive the most change is the consumer. And I think we're going to see over the next 24 months to 36 months a dramatic change in who the key players are in healthcare and who's driving the equation. And today healthcare gets done to us. And I think what's going to happen increasingly, and we're seeing it, which is people are saying, I want healthcare to look like the rest of my experience. I want it to be 24/7. I want it to be on my terms, not on someone else's terms. I want to tell people what I need, not what they have. And I think things like narrow networks are going to go away, because I think people are going to say, you're not going to tell me where I'm going to get my health care. So I see a very big change. The second thing is, it's interesting, because if you look at and read about what Amazon is doing, it's pretty clear what they're doing. There's 80% of all the households in the country are using Amazon Prime. If Amazon says, I'm going to have Amazon Health now, and it's just X dollars a month, and you can get all these services now, and you're already signed up for them, what's going to happen? Dramatic shift. If Google says, when you Google and you say back pain, I give you 4 options of where to go, which is something they're working on. What do you think people are going to do? They're going to click, because it's easier and it's better, and they don't have confidence in the existing system. So I think you're going to see, this is the unleashing of the consumer, and we've just educated consumers across the country that they can take charge of almost everything from their home, and they're not going to let that go. So even things like, virtual care, when Teladoc does 10 million visits, that's 10 million people who have gone and they've done their visit online. And when they're prescribed a medication, it's really easy online to press a button and say it's waiting for you, or it will be delivered at home. That's this virtual experience that, and I think we're going to talk less about consumer digital healthcare. We're just going to talk about health. And like everything else, it will be a part of that. It will be a continuum. When you go on, do you want to do chat? Do you want to do talk? Do you want to do video? Or choice? So I think we're going to see choice and consumers become the big words.
And Glenn, how do so healthcare has mostly always been a B2B construct of how it's, and it's felt like that from a consumer point of view. It's felt clunky and awkward and really not designed around the consumer. The trends that you're describing, to bring it back to employers, what do you think are what's the impact on employers as they think about their strategies for the next year and their employee populations and those families? What should they be thinking about?
Well, I think that what we've seen, anytime you consumerize something and you put the consumer in charge, she or he is much happier and they get better outcomes. And so, if we think about travel, we used to go to a travel agent, we might have waited in line. Now we do that, we have more optionality. And what's happened? Complaints are way down. Why? Because we put people in charge. They know what they need best. If you turn on the TV today, look what's happening on medications. I bet you everybody on the call could name Paxil and PillPack and 5 other different services, how to get your meds with Ro confidentially, how to get them delivered. Everybody knows the name of not just Zoom, but Teladoc and Doctor on Demand and other services like that. And people are much more likely to say, if I want to talk to a doctor at 10 at night on Friday, I'm not going to wait till Monday anymore. Those days are gone. I'm going online. I'm going to talk to a doctor. She may be from my health system, or I don't really care. I'm going to talk to a doctor. I'll know who it is. And that's the new level. So once you let the genie out of the bottle, let's talk about, physical therapy. We have a company called Resource One that we funded. And basically what they do is they have virtual physical therapy. No one wants to go sit in a room with 10 other people right now on a table that somebody else was there 10 minutes before and will be there 10 minutes after. They want to do it at home. So now we've enabled that. A lot of people are going to say, it's super inconvenient to go twice a week for a PT when I could do it at home with some assistance over video with great resources. And so whether it be, Resource One or Sword, or I could name a bunch of others too, one that just got a $3 billion valuation. So all of this is going to start to shift. And I think employers are increasingly going to say, here's a pot of money, here's a group of services you choose, because we don't want to make that choice for you, because then you'll blame us if it doesn't work. You choose, we'll organize it. We may use, someone like Courtney's organization to help vet them, because we don't want, they have to meet a certain standard of quality. And I think that's the stage. And then we're going to have people who organize that into guided experiences, just like every other part of our experience. And I think it's going to be a lot better. And by the way, that will allow our physicians in our in-person visits to be longer and more impactful, because they'll focus on the right things. And I think that's the health system we're going to see. And I think it's going to happen very quickly, because we've seen coronavirus collapse what would have taken 5 or 10 years into a year.
Courtney, just responding to what Glenn is talking about and the consumerization of healthcare and what that means for through a lens of employees and employers, in the conversations that you're having with your clients, is this top of mind for them? Is it explicitly something they're talking about? Is it implicit in the kinds of solutions they're looking for, or the way that they're thinking about evaluating their health and wellness strategy? Or is it like they haven't gotten there yet?
I think it's in progress. I think it's definitely in progress. I agree with you. We've been in a period of time where employers, if you say consumerism, they finish that with consumer-driven health plan, which is a high deductible health plan. I think what has now moved, and frankly, the pandemic has really kind of, I think, accelerated this, is understanding kind of the congruence of how all this innovation in the market focused on the consumer, now needs to intersect with how their employees have needs that they didn't think about fully before the pandemic, probably. So I do think this whole theme and direction of it's about the consumer, it's about each individual, and healthcare benefits as designed by the employer are naturally not very aligned with that, because you design one plan, or maybe you have 3 plans or 4 plans that everybody enrolls in. So employers know that needs to change. And one way to do that is through this focus and this movement around consumerism. So putting in the right solutions, covering the continuum so individuals can come in, reach in based on their needs and interest, and optimize what's best for them. So this truly becomes about the end state of being able to personalize and customize what you need. And so that's why, this, as we've seen, the migration toward, not just one category, not just a singular solution focused maybe on diabetes, but a front door, a front end kind of hub model where an individual can reach in and there's a variety of things and something to help maybe steer them through that, guide them, and let them pick what they want, has a lot of appeal. So, and arming them with the right information, targeting the right people based on what we expect that they will like and what they will need. That is really the direction. So yes, employers are headed this way. Some are further along than others. I think we need to figure out a way to tell that story cohesively and in a compelling way so employers can adopt strategies that do that effectively.
And Courtney, you mentioned some of those employers, the Boeings of the world, the Baxters, the Geicos, we could Targets of the world, and even while Haven was not successful, I think it was successful in laying out the problem. And I think you'll see Amazon and you'll see JP Morgan and you'll see Berkshire Hathaway all take very rapid and immediate actions to say, this is a problem. We've learned a lot about it. We're going to benefit from all that learning. And now we know what to do, but they're going to take different directions on doing it. But I also agree with what you said. If you look at a Virgin Pulse, what they've done is they've kind of organized a bunch of services, and it was a first generation. It's not perfect yet. It's not personalized exactly the way it should. They've organized that. Express Scripts now has kind of a shopping mall. You can go in and pick multiple ones. So, I could name a number, and I'm trying to be very kind of objective and not picking on anybody and not also promoting anybody, but that's what we've done. At Livongo, and now with the merger with Teladoc, you have this whole continuum, which is kind of interesting. I mean, it's fascinating. Kaiser Permanente did a study, and they said, how do we best treat people with mental health challenges? And we all know, I think we all understand that sadly, because of the coronavirus, we've created anxiety, we've destabilized people, there's lots of dislocation. So that has pushed up mental health to be maybe the #1 issue. And they looked at it, and they did this last year, and they said, let's see what happens if we offer large groups of people a digital solution as a first step. And it's fascinating. It's in the New England Journal of Medicine, the study they did that said that 40% of the people once offered, downloaded a digital app. Why? It was convenient, it was confidential, and they could start to get help. And it's kind of fascinating. Again, when we put Livongo together with Teladoc, they had the other end. They had BetterHelp, which was people. We had the digital front door. Put those together, and now somebody's in charge from the comfort of their home or work. They can take a path, they can upgrade. I can talk to a person or not. I can do it confidentially. We put them in charge of that with some good guidance, but we put them in charge of it. So I think that's a model that we'll see across the board from many companies. And it's what makes me so excited about what's coming, because we've had the pieces. Now we get a chance to put them together with organizations like yours to help us. And that's where I think, Stephen, the next generation of innovation comes from. how do you put that together in an experience that feels as good as Livongo felt for people with diabetes or hypertension or behavioral health? How do you do that across the system? Because we all know navigating the system today, if something happens to you, none of us, including all three of us on the call, it's kind of like, if I, hurt my knee, where is the best place to go? It's really tough. And is it covered? Is it not covered? And 100 questions. And even many of us on the call who spend our lives in healthcare, when it happens to us, we don't know what to do. So that's what we got to solve.
Courtney, I want to take this up a level, or I don't know if it's up or down or sideways, maybe it's down. But a lot of where this conversation is going sounds to me like we're talking about employers playing, in some ways a larger role or a more active role or in employee health and wellness. And you mentioned, in plan design, there's a few plans that employers negotiate and they offer to their employees, and that's because they can achieve efficiencies by doing that. And some of this, does this sound to you, as we move kind of more consumer-directed healthcare, more virtual care options, employers playing sort of more of a role in helping select or make available options for employees? Does this sound to you like, wow, this is going to be really expensive? And how are the employers going to navigate this? Or do you have a different reaction?
Yeah, I mean, we're effectively talking about some level of, disintermediating the traditional health plan. And the reason employers have those 3 or 4 options today is because we have such this entrenched legacy model, right, with the national carriers providing a network and the discounts. And, that's what everyone's been living off of a long time. So we're talking about solutions now that start to disintermediate that. So the key question you're asking becomes, will this deliver value? If we're just paying for lots of different parties to do different things, kind of a best-in-class model, and we aren't getting the return on value, right? And we're not getting economic savings, and we're not getting better health outcomes, and we're not eliminating wasteful care and avoiding unnecessary care and identifying people earlier, imparting more prevention across the organization, then yeah, this could be expensive and not a good result. I think our hope and our belief, I mean, we're committed, believe that there is a better way to do this. I think we're all in agreement with that. So yeah, we can do this, we can build this. I think it takes organizations in some regard, not just everyone who innovates is on this call, but I think our organization, consulting firms, advisory firms that help package things, right? And help employers step into this without having to piecemeal it themselves or put it together themselves. So that's what I actively work on in packaging, bundling solutions, putting things together in ways that work with how we consult with clients and make it easy for them to see the value and move forward with adoption.
So I want to,
Steven,
go ahead, Glenn.
One thing, there's a bunch of chatter going on about, incentives and misaligned incentives. And there's this great quote from Upton Sinclair that says, it's difficult to get, he says, a person or an organization to understand something when their job depends on them not understanding it. And, I think what we have, and Courtney just talked about this, is we have misaligned incentives. If you're a health system, you get paid to get people into your hospital and get those beds filled. That's the way most health systems still work today. If you go to a surgeon, she or he gets paid to operate. And that is just the reality of what happens. And by the way, it's not because they're bad people. They've been taught that the way they help people is to operate. But in fact, a better choice is to first try physical therapy and not risk infection and not risk surgery. But they're not going to say, let's try to keep you out of the hospital. That's not the way it works. So we have these misaligned incentives. We have to get organizations, in many cases outside the existing system, to come in and say, it doesn't benefit us financially if you get surgery or if you don't get surgery, or we only want to do the right thing for you. When we get those kinds of organizations coming in, then in fact we'll be better off. But most important, all of us as patients will be better off. All of us as payers, because it's not just large self-insured employers, it's also all of us who pay an increasing percentage of our healthcare costs. So we have to get, to a different system that really is focused on what's best first and foremost for the individual, and then what's best for the person paying the bill, which in about half the cases in this country are businesses. And there's nothing wrong with that as long as we always start with quality first.
So I'll turn back to Courtney. So, you're talking to employers. I don't know exactly when the season starts, about, it's obviously early in the year, but where you are in the cycle, but, you're planning ahead for next year's benefits. To what extent is there a conversation about, the alignment notion that Glen's talking about, where the solution providers would be taking risk or shared savings or some sort of pricing method to what extent is that changing the way that employers are evaluating solutions, or is that not really come into play in any sort of widespread manner yet?
It's progressing. I think employers are expecting, across the board, I think employers are expecting some type of, skin in the game guarantees for performance of the solution. It depends, and what those are will depend on the nature of the solution and what it does. Early days and even still today, engagement is a key buzzword, right? What are engagement levels? What are completion levels for programs that kind of have defined timeframes? What are the sets of, we'll call clinical performance metrics? In a case of a, quality or navigation-based solution, how effective is the solution in driving people to the right care? What's the uptake rate? Satisfaction. These are all things that people look for and want some form of guarantee around. I think increasingly what we want to see, and what employers, I should say, want to see, is getting paid based on performance entirely. So going at full risk for, clinical improvements, for sustained participation, for high satisfaction, and ultimately for impacting cost, right? Translating that into lower cost, which is, a harder thing to measure and get to. And that's, some of the work that we're doing, some of our, deep analytic experts and actuaries working on ways to measure that. Whether that be, and again, determining what those critical measures are by type of solution or solution domain, and assessing what, maybe it's, avoided readmissions. Maybe it's reducing the number of surgeries in a particular category because they're redirected to, to less aggressive care. Maybe, it's a certain set of clinical measures, right? Obviously that relate to diabetics. For musculoskeletal, it's going to be more about avoidance and, starting with, triaging the level of care. So if we can identify those service categories or those measures, and then we can talk about utilization, the impact, the unit cost, and the overall, translate that ultimately to what is that impact of that solution on the overall cost per employee per year, we can have some predictive value about the impact of the solution. And then we can balance that against actual performance. So that's the type of direction we're going, and helping, employers are going there fast. So, to answer your question, I think that's the alignment between delivering value and how the solution is paid. There's also an element of alignment we've talked about here between making sure it fits into the model, right? The solution fits in, that the employee experience is designed in the right way. And we've done some really deep studies where there may be 3 or 4 touch points in a design of a musculoskeletal solution. And we can look at how people come in the first touch point, how many people then make it to the subsequent second and third touch point. And we can try to determine and ascertain, where's the flaw in the design. And in one large study we did in that case, we ended up eliminating a solution that, it was downstream. It wasn't getting effective participation anyway. And we found a way to design it differently with the upfront navigator. So that's another element of alignment I just wanted to mention.
I think that's really interesting. And this may be a tangent, but are you able to do studies like this across employers, or is all of the work that you're doing within a particular employer as you're trying to measure value and ROI?
So interesting you asked that. We certainly do a lot of this at the employer level, but what we are working on is a way to look more, at a larger data set, a really fully credible large data set that would aggregate right across what we learn by individual employers. And so if we can build, some type of common framework by type of solution that looks at what some of those critical measures are across an aggregated data set, we can start to do, prospective modeling of what the impact of a solution would be, normalized to a particular employer's population without even having really much of their data, right? Just standardly available data, census, average cost, and obviously we have the demographic information through the census. But we certainly do deep analytic, match case analysis studies, and longitudinal studies we've done on some solutions for very large populations. But our vision is we need that at an aggregated level.
And what's the time frame that you're seeing employers focus on as they measure ROI? Is it, and in the beginning, I think you both talked about the kind of challenges and the need to demonstrate an ROI and how that's shifting. Is that, over a quarter? Is it over a year? Is it 5 years? What is the time frame that employers are thinking about when they're asking you to help them evaluate the ROI on different solutions?
Well, I think their time frame's getting shorter, but there's a sophistication to the question because there are certain things we can't observe that quickly. For many clients, we are doing a quarterly dashboard where we're giving them quick, quarterly information on participation, sustained engagement, program completion, and then, there's other measures that we do more on an annual basis. I think ROI, obviously speaks to a little bit longer term. It depends on the solution. It might be a year, it might be 3 years. But the typical renewal cycle for a lot of solutions is about maybe 2 to 3 years. And, there's definite, ask for this type of data at those renewal points for sure. So that, I think it's a staged thing, but we're accelerating the visibility, right, into some of this stuff. So, I think more information is desired sooner. There's also an element to the value of a solution, especially those that focus on prevention. The employer recognizes, many do, we explain that they may spend more money up front, right, to engage people and get them on the right medication, or engage them in the right kind of activity. So there's an understanding and recognition of that, and we reflect that. That's not something that we want to be, consider a detriment to the solution. If it's doing a good job identifying pre-diabetics, and even those that might be candidates for diabetes reversal, that's a great thing. So we're not that saves costs longer term. And, so that element is factored in.
Yeah, Steven, I would just, I think what I would say about that is the employers that we've seen have a relatively short time frame. It does vary by industry because part of what they're looking at is how long are they going to have the employee, which is understandable. But we've seen people, if you can't get an ROI and very positive results and movement within, 12 to 18 months, if you don't start to see something, I think it's very tough to do it at scale. And, again, at Livongo, we have thousands of employers, not hundreds. Can you get the top names that we've mentioned a few times on this call? They have a better vision. They are innovators. They lead the pack. But as you start to move down that path, it gets pretty tough and pretty economic pretty quickly. So now the good news is, as Courtney was saying, we aren't talking about one thing. So we're talking about a variety of things. So if you do appropriate site of care, you should be able to see if you can move people from a hospital setting to a surgery center. That might cut your cost in half. If you can do that on 100 different surgeries in a year, you can see that materially change. If you use Center of Excellence, we see this in, at a company called Bridge Health. They've been most successful in doing that, from a surgery perspective, and people have seen great results. And they see those pretty quickly because in non-COVID times, people are getting surgeries every month. And so you can say, well, we're going to do 500 knees this year. And if we can get half of them done at a better site, of more appropriate site of care, not only will we reduce costs, we'll probably cut infections in half. And so that's one. Again, if you can get people to try things, and again, I mentioned Recovery One before, if you can get people to use a physical therapy alternative instead of going right to surgery, if you can get people to come off their meds if they don't need them anymore, because we write prescriptions very quickly, but we don't discontinue meds almost ever. And so there's all these opportunities to find. Again, I think Courtney and organizations like hers can help employers organize those, rank those, and again, because I think we do have the solutions here now.
So there's it's a little bit of a different topic, but we've touched on, I'm just looking through what the audience has been chatting us about, and we've touched on most of the subjects they've asked on. One we haven't is how you get employees to adopt solutions. And, that has, certainly historically, when you look at various health and wellness solutions, the adoption rates have been, like laughably low in many cases. And that's changing. So what is changing that, and how, what are the strategies? And obviously, if you have such low engagement, it's going to be really hard to demonstrate an ROI. So, what are the best practices that you're seeing, or the best kinds of solutions, or what is it that differentiates a solution that has high engagement from one that really doesn't?
Well, I'll jump in on that only because I think Livongo fortunately set the standard in that area. If you look at pre-pandemic, most solutions, they were in the 3 to 8% adoption range. Telehealth for sure was there, but other solutions were as well. And in Livongo, we were at 35 to 50% consistently across organizations. And I think that has to do with a few things. One has to do with, first and foremost, the quality of the experience. Is it actually better? Do people like the experience? Often organizations, when I'll talk to a group of hospitals and I'll ask them to raise their hands, do you have an employee engagement program? And everybody raises their hands, everybody. And the answer is those don't generally work because what you're selling, people don't want. Google doesn't have an engagement program. They just happen to have a very valuable product. Airbnb doesn't have an engagement program. They have programs that people like and they use. So we got to get to healthcare to the point where people have quality programs that they say, this is better than what I used to have. And once you can do that, at Livongo, no copay, available 24/7, on and on. And people said, this is just simply better. So, but the second thing that wasn't as widely known is we employ probably one of the largest numbers of data scientists to personalize the experience, to use different languages where that made sense, to understand that in different areas of the country, when we went to the South and we said to people, we would send them a note and say, hey, if you have diabetes, and people would say, I don't have diabetes, even though they were on insulin. So we knew they had diabetes. Why did they say they didn't have it? They said, well, I have a touch of the sugars. One, that sounds a lot better than a disease called diabetes. And two, everybody has a touch of the sugars. And so we can smile about that. But we literally changed our language depending on what area of the country, depending on what age you were. Some people, parents who have young children with type 1, have a very different set of concerns than somebody who's 65 and he or she was diagnosed recently and they're taking pills. Very, very different. So we use data science to really personalize that. And one last thing I'll say, and that is with connected devices, we would call people and they'd say, oh, you called at exactly the right time. I have a question right now. And it wasn't magic, it was data science. We could see their numbers had dropped dangerously low or were dangerously high. And at that moment, we would call and say, how can we, provide assistance? What do you need right now? And they would tell us. And instead of bothering them randomly. So I think it's a combination of high tech, but also high touch. And how do you add real value? And that's what we have to think about. Again, too often we're trying to force somebody to use a product that just doesn't work well. You can't bribe your way to a better healthcare system.
Yeah, I would say employers, there's a number of other, in addition to all of that, there are a number of tactics employers take through communication strategies. Navigators like Accolade, just as one example, play a key role and have proven the ability to really drive up just by creating awareness and aligning people. And there is a role in place for incentives because there's such an economic impact here to members at the end of the day, right? And so we do see, deliberate, incentives designed to get people to do the right thing. So, and I know we're going to hit time here, but there's a number of tactics, right, that come into play here through enrollment and other opportunities to drive that participation.
And I think you got to use all of them.
Yeah, it's a multi-pronged approach for sure.
Thank you, Courtney. Thank you, Glenn. Thanks to everyone for joining us. Really appreciate the dialogue and the conversation. One of my key takeaways from this is actually relates to the value-based care, which everybody's been talking about for years. And a lot of this underneath this conversation is a suggestion that value-based care is going to come as a result of employers just as much as it is from other parties in the system. And I think that is a really exciting development. You will all receive an email with a survey. Please fill that out. It'll help us give us feedback on what you'd like to see going forward. We will be hosting more events in this series, so keep an eye out for those. And if you opted into the virtual networking, please go to and open that link now. Thank you very much.